I'm Elizabeth Kubai. I'm from Ethiopia.
I'm Nana from Ghana.
And we're here today working on reproductive health supplies. So what are that you think is similar to your country?
According to the presentations in the morning, I've learned
A bit
that,
loud, please.
Okay. I've learned that the reproductive health issue is not about generally about reproductive health issue on the spot. It's about delivering the system at the grassroots level. Unless you're not doing that, it's nothing.
Yeah, I also have learned that commodity supply is a big issue. There are gaps in terms of commodity supply, contraceptive supply, both in Uganda and Ghana. And this has resulted because of withdrawal of funds or the fact that donor support has gone down for some time now. So for me, I think the workshop is very good. And I'm here mainly to learn from the Uganda experience so that I can apply it back home in Ghana. But then one thing that I have learned, out of the discussions, I've realized that resource mobilization awareness should not only be donor driven. It's about time Africa, we took our own destiny into our own hands. At the end of the project, what are we aiming at? For me, as an advocacy person, at the end of the project, I want us to own the project. I want us to own our resource mobilization exercise and not just wait for projects which are time bound before we can do such advocacy programs.
That's fabulous. And do you agree Ethiopians to lead?
Yeah, in my country, if you take Ethiopia is the second largest populous country in Africa. We need the service too much. It's a burning issue in my country even.
That's me.
It's a burning issue in my country even, so we want them timely.
I think statistics have shown that if women utilize family planning or contraceptives, at least we'll be able to prevent 30% of maternal deaths. So I think for me, it should be a priority. In Ghana, we cannot see it as a priority because the budget line for reproductive health is lumped together. You cannot see a clear-cut distinction between budget lines for contraceptive supplies and other health issues. So that is what we want to advocate for, that there should be a clear-cut distinction between what is going into reproductive health supplies and contraceptive commodity supplies in particular, and the other health-related budgets. So that is one thing that I want to advocate for, that it should be a priority, because if we do that, we make it a priority and we put enough funds for it, we'll be able to prevent a lot of deaths.
Government and other donors just to do it timely, at the appropriate time, to reach the grassroots level.
To get to the persons.
Yes.
To get to the people.
To get to the people, but it has to be timely.
Yes.